Children aged 5 to 11 are now able to get the Pfizer COVID vaccine. The final approval came yesterday, and now parents are faced with the questions of whether to vaccinate their kids or not. Joining me now to help answer those questions is Dr. Gregory Zimmett, professor of pediatrics and clinical psychology at Indiana University School of Medicine. Dr. Zimmett, thank you so much for taking the time to speak with us today. First up, is the COVID vaccine for kids safe?
Yes. The short answer is yes, it is safe. In the clinical trials, it was tested on quite a large sample of children 5 to 11. And in the previous clinical trial, they tested it on a lot of older children, like ages 12 through 15. And at this point in time, actually over 8 million children or adolescents 12 to 15 years of age have received at least one dose of vaccine. Nearly 5 million 16 and 17-year-olds have received a dose. And, you know, they're the short-term side effects that all of us who've gotten the vaccine, many of us experience where you don't feel good for a day or two. Those are common, but there are very, very, very few long-term side effects. And you know, this vaccine that's been approved for 5 to 11-year-olds now is, you know, very, very safe. It's a lot safer than getting COVID, and I think that's the bottom line.
Yeah, and I want to talk to you about that. Talk about the risks of the vaccine in children compared to the risks of children getting COVID.
Yeah, so in terms of the risks of COVID, early on in the pandemic, the message that went out is don't worry about your children. It's really something that affects older people. I think that was a mistake in some ways, and part of it was that that was the pre-Delta pandemic, and what we found is that the Delta variant of the virus seems to infect more children and make them sicker. In total, 645 5 to 11-year-olds have died of COVID nationally, and over 8,000 have been hospitalized, and many have long-term problems with COVID. So any other illness like this, if it was only in children, we would be delighted to have a vaccine to prevent it. I mean, that we could potentially have prevented many of those 645 deaths is really wonderful. So, I mean, COVID is much more of a problem for older individuals, but it's not as if it's fine for younger children. So COVID is definitely a risk for younger children. Plus, you know, there's also been some confusion with people thinking that children are less likely to transmit the virus to other children and to adults, and it turns out that they very much can transmit the virus. And so there's reasons to vaccinate children in terms of keeping them safe, and that's to protect children from COVID directly, so it's a personal benefit for that child, but also to protect those that the child has contact with, so parents, teachers, grandparents in particular, anyone in their family or friend group that might have a chronic illness that puts them at more risk. So there's a lot of reasons to consider vaccinating younger children. The vaccine, you know, people have heard a lot about this myocarditis, which is a heart inflammation. In nearly every single case where that's occurred, it has resolved pretty quickly. And I can't tell you how incredibly rare it is. Myocarditis is also a side effect of COVID, and in COVID patients occurs much more frequently than it does after vaccination.
Okay. Well, let me ask you something that I'm hearing some parents ask about, and that is that, you know, when kids are sick, the medication is often based on their weight. And although the kid dosage of COVID is 1/3 of the parents, still there's a big difference between a 5-year-old and 11-year-old as far as weight goes. How come there's no difference in the dosage for children?
You mean in that range, 5 to 11? Because it's 10 micrograms as opposed to 30 micrograms for ages 12 and up.
Correct.
And, you know, part of it is it's really hard to do the studies, right? So if you start coming up with different doses for 5-year-olds versus 8-year-olds versus 10-year-olds, then you have to do whole separate studies with 5-year-olds, 8-year-olds, and 10-year-olds with that different dose. So they recognize that that children have a much stronger immune response than older adolescents and adults, and that's why they settled on this 10 micrograms, which, as you mentioned, is a third of the dose for older adolescents. It may be in time that they find that it can be reduced more, but that's again going to require a fair amount of time. But as it is, it really is a significantly lower dose in the vaccine for the 5 to 11-year-olds.
And it is safe. Dr. Zimmett, you've given us some really great information here. We appreciate your time. I wish there's a lot more I could ask. I wish we had more time to talk, but we are out of our time now. So, okay. Gregory Zimmett with the IU School of IU School of Medicine, thank you so much for taking the time to talk with us about this important topic.
It's my pleasure. Thank you.
Thank you.